My name is Carol Rogan and I'm the coordinator of Dementia Research Network Ireland. And I'm joined today by two of our speakers, Dr. Annalisa Setti and Feargus Fawsitt, and they're both from the School of Applied Psychology in UCC. So I'm going to hand over to Annalisa.
Yeah, today I would like to talk about a project that I've been involved with for the past few years. And to just give you an overview quickly of how this project was born, I would like to briefly remind us, so I think everybody is a little bit more familiar with the process of research these days, but usually how it works is that, you have experts and scientists that work in a given field. So for example, healthy aging, and they would have research questions, for example, how to get people more active, improve their activity levels, their memory, their well-being. They would devise a program and trial this program with a group of people and have a control group that doesn't take part in this program, and then test them again on those variables and see if they have improved. And that's the classic framework to to see what works, and that's how we know that, for example, physical activity works to improve our healthy aging process. But the project that I'm going to talk about is a little bit different, because it's what we call a community-led project. And a community-led project means that it means that there was a community member. So in that case, you see here in the picture, Phil Goodman from the Young at Heart, which is a senior citizen group in Cork. And she contacted me and she said, Annalisa, I had this idea that I would like to use activity trackers to improve activity levels in our group. So what happened is we sat down, Phil, myself, and the manager of the Douglas Village Shopping Center, which we may know for, unfortunately, the fire, but now is open again, but pre-fire, we sat down, they sponsored the activity trackers, and we sat down and we thought, okay, what do we want to do? How this program has to work, and it was really led by the Young at Heart research questions, what they wanted to do, what they wanted to get out of it. So we tried it, and there was a lot of people involved. First of all, my PhD student Jessica O'Brien, who really put in a lot of work and a lot of enthusiasm in this project. And through the iterations, so we tried this program, and then we asked participants, how was it? And we learned from it, and it has changed in different iterations from that. So that's a community-led project. So what is it? It is a 6 weeks walking program, and people meet at the beginning, and we give them a booklet with some instructions and some tests. And we give them an activity tracker. Is not exactly the one in the picture, but is similar enough. We set them up, and then people go off and walk. We don't set out a specific number of steps for people to reach, but people that have to just improve, and they can write down the steps and whatever notes they want to do, the thoughts they have in their booklet, and we check in every couple of weeks. For 6 weeks, and then at the end we gather, and we celebrate that everybody has improved. Everybody gets a certificate, as you see in the photo. That was the first group. It was very formal. We even have the Lord Mayor at the time, so that was pre-COVID, when we could be all together in the same room. And this is the format that we have built on, and then hopefully improved over the different iterations. So what is the first learning from this project, from this activity, community-based project? The first learning is that we need novelty and challenge. And how did we provide novelty and challenge to train our brain, to keep our brain active? So in this project, the first challenge was to use the device, because many people, the majority of people, had never used a tracking device. So even, with our help, but to set it up, to use it, to discover, how to count to record the steps, to maybe use other functionalities of the device. That was a challenge. So it was a new learning, something new that they had to do. Then there was this group discussion. So there was a social engagement that also presented a challenge. Some people were prone in maybe comparing how many steps. Some people were less keen in doing that. But, there were chats about how, exercise improves our overall health, our cognitive health. So there was this new element. And then there were the tests for those that took part in the research part. Which was not compulsory by all means, but there were memory tests, there were recall, verbal fluency tests, there were well-being, mood, and activity levels. So there were different tests that people may have never done before. And what is important in that is that also gave people an awareness of their own performance. So did they walk enough? How many steps did they do? Did they find the test difficult? Did they struggle using the device? And that was a challenge, but also gave self-awareness, which is important for changing our behavior, to be more aware of our sort of baseline. The other important element that emerged is what in positive psychology is called self-compassion. So being aware that I'm at a certain level and I can always build from that level. And that's why, although there are guidelines for, how much exercise one should take every week, every day, we didn't really set a target because we wanted people to set their own target and being aware that they could build on their strength and go with a little bit of self-compassion instead of thinking, oh, I'm bad because I didn't do as many steps as Mary, who did better than me. So these two, self-awareness and self-compassion, are very important elements, and they lead us to think, okay, what are the activities that we can do in our daily life to get this novelty, to get this challenge? And one participant, from the point of view of the being more physically active, expressed it very well. And they said, I was watching it, so talking about the device, and doing my steps. And it did encourage me to walk further, park further away in the car park. And, it encouraged me to build up the steps. And I do a bit of walking, a bit of exercise to get a certain figure. And so it was very encouraging from that point of view, so be more aware and using daily life to build up exercise. So that's an important take-home message. And if you see in the column there on the right, there are activities that we can do in our daily life to keep more active. One example is, pick up a new hobby, dance in your kitchen for a certain amount of time. Or pick up an activity or a class that requires interaction with other people. And why are they in two colors? The two colors mean that the first type of activity you can do by yourself, and that's important to still do these kind of things, to keep introducing novelty and increasing challenge in the activities that we can do. But the best type of challenge is when we can't predict always what happens. So for example, talk with other people, play a game with other people, make a sport where there is an instructor and we don't know what the routine is going to be. And that is because an unpredictable environment is something that really stimulates our brain. Because with aging, what we tend to do is, because we have these life experiences, we rely on these life experiences, which is good, and it is adaptive. That's why we have our memory, to be able to plan for the future, to know what we expect. But also we need to be flexible and able to react to new situations. And we need to train our brain to do that, even in older age. And we need to do that systematically and incrementally, and that's very important. Second learning is that nature can offer a lot to our cognition, to our mood, to our well-being. And so walking and observing nature is very important. And that has emerged very much with the lockdown, that people, there is a report from the Environmental Protection Agency that shows that people walk more, they go more outdoors, they seek for more contact with nature, and this is related to higher levels of vitality. And this is backed up by a lot of scientific studies that show the benefits of nature. So what we did in the Step Up, my colleague David O'Sullivan, who is an expert coach, introduced what is called eco-coaching in the Step Up. So he had 3 sessions with each participant, and we're very grateful that he gave his time for that. And these sessions, in these sessions, he asked the person to reflect on the code, on what had a meaning for them, for example, what made them happy. And then he asked them to look while they're walking for something that relates to that meaning, to that plan that they have, to what makes them happy. And then we discuss that in the next coaching session. So an example, a participant noticed bird songs. And once they become to notice bird songs, they seem to, the bird songs seem to accompany them in the walk. And then they reflected that that made them very happy. And then in the coaching session with David, they reflected on how they could access resources of happiness in their life, starting from what their life, their daily life was. So that was a great addition in the latest Step Up wave, and help people really understand the benefits of nature and the importance of our environment. The third learning, Feargus will talk about, and it is about positive perceptions of aging. And it is something that is really came out strongly now with the pandemic, and how perceptions of aging are important and impact our cognition, impact our health. So Feargus will talk about that because it is his PhD work, and I will leave it to him in a second. And I want to make a final point, just to summarize what very briefly the points I touched upon. The first point is that we need to keep challenging ourselves with novelty. Novelty can be a new technology, a new activity, a new environment, and we need to keep practicing. We need this incremental difficulty, but we also need self-compassion. So we have to start from a positive view of this challenge. It's not always easy, but it's possible. Second, learning. We can benefit from our environment. We need to understand what are the environments that are more suitable for us. Hopefully they're accessible. And in that sense, advocacy is very important, not just the single individual. We need to keep in mind that nature has a great potential, proven potential, to restore our attention, to make us feel more vital, and to help us find meaning and motivation in our activities. But we need to focus on it. We need to pay attention to it. In fact, there is a recent study on thousands of people that showed that the benefits for those that self-report to notice nature more in lockdown, the health and mental health benefits are proven. Third learning is about positive perceptions of aging, and I will leave this to Feargus in a minute. But the point that I also want to make is a suggestion. And the suggestion is this project came from the community. It's a community-led project. So if you have research questions, if you have a walking group, if you have an exercise group, a Tai Chi group, or even no group, and you want to, you have a research question, it is possible to develop your own citizen science. So get in touch with us, with another university, with somebody that that works in the area of interest, and give it a go, because it can give very useful information and help to the people and to the scientists. So with no further ado, I will then leave it to Feargus that will talk to you about perceptions of aging.
Thanks very much, Annalisa. So yeah, that's what I'm going to be covering, what perceptions of aging are, how they affect you, and what you can do about it. So what do we mean by perceptions of aging? Perceptions of aging are what you think of when you think of aging, what happens when you think of older adults. So if you think of older adults and you think of wisdom and you think of warmth and you think of competence and experience, you know, those are very positive perceptions of aging. Unfortunately, society can be quite negative about perceptions of aging, and they tend to go for the words that are on screen. Now, what happens if you view older adults this way? You spend your entire life thinking older adults are quite forgetful, and then you're an older adult and you're applying that stereotype and that perception of aging to yourself. Now, this is really important, not just because of the stereotyping and the discrimination that comes as a result of it, but there's also an internal factor. Perceptions of aging tend to be a self-fulfilling prophecy. So if you think older adults are all forgetful, you tend to be more forgetful when you reach old age. And this has been shown in lots of decades spanning research where people have looked at mental health and including research in Ireland over the last few years from the TILDA data. Negative perceptions of aging have been linked to more depression, more anxiety, more loneliness, slower walking speeds, a higher risk of dementia, poor physical health, poor longevity, and poor quality of life. The longevity one is one of the most interesting because it was originally done in a 23-year-long study where they literally just divided the participants in half with the more negative and the more positive. Now, unfortunately, because negative perceptions of aging are so pervasive, even the more positive were quite negative about aging for the most part. But the more positive group lived on average 7.5 years longer over a 23-year span. So this perceptions of aging construct is really important, and it does seem to have a lot of influence on people's life and well-being. So I did a little research with older adults in Ireland. So I went out and spoke to focus groups of older adults in retirement homes and in active retirement groups and men's sheds and exercise groups and a few interviews with people. And they put it very well. So, you know, I've done a lot of theory on why perceptions of aging become a self-fulfilling prophecy, but I think they put it better than I could. So they play out in your thoughts and behaviors. So thoughts that people have, this is a quote from a participant, a lot of people have the mentality, oh, I've reached this age, so I should be expecting these ailments or illnesses, nearly inviting them on themselves. You can see the other quote below where your thoughts sort of reinforce they become self-reinforcing. So sitting out and about to be sociable and you stimulate your brain, I guarantee if you're sitting down inside and you have a pain in your knee and your knees are stiff and it comes up into your head, my knees are stiff, now you have a second opinion coming in on the first one. And behaviors, keep going, so when I spoke to older adults, I asked them about what advice they would give to anyone reaching any particular milestones. So things like my dad recently retired, and what advice would you give? The overwhelming answer I got from people was keep going, keep active, keep doing things, because when you stop and you start thinking I can't do things, you end up in a rut and depressed. So this is it's a little bit of a simplification, but this is kind of how perceptions of aging play out for older adults. If you think these things are going to happen, they tend to. An example from real life, I have an aunt who had joint pain for years, and she's relatively old now, but she had joint pain for years, and she thought, well, this is just a normal part of aging. There's nothing I can do about it. And she eventually did go to her doctor about it. It got so bad, and the doctor said, no, this is actually quite treatable. They managed to fix it, and she felt infinitely better for a long time after that. But she had just assumed it was part of aging. There was nothing you could do about it. So she, didn't try to address it. So what can we do? So the first thing we could do is improve societal perceptions of aging. Now, this is obviously quite difficult, but it would, reduce the number of stereotypes in media, talk about aging more positively, challenging stereotypes, challenging negative perceptions, things like that. So that's what we could do as a larger group. But as an individual, what can you do? So look to positive role models. So I have a friend who's in her mid-90s now, but she took up horse riding in her late 50s. And she's been going twice a week until she was about 93. And she stopped about 2 years ago, which I think is amazing because it's, you know, quite it's quite a moderate exercise or severe exercise. I know anytime I've been horse riding, it's been very difficult and challenging, and she's kept it up into her 90s. It's very impressive. The downside of that is if you focus on people who are too positive, it can be very disheartening. If I take up playing the piano and I spend the day looking at people under 10 playing pieces of piano that I'll never be able to play, it's not going to encourage me. So we need to be realistic and as Annalisa said, self-compassionate about what we can do. Like my grandmother, who is 90, took up a smartphone during the COVID pandemic, and she'd never had a phone. She doesn't really even turn on the TV. But she wanted to stay in contact with people, so she got a smartphone, and we all now get video calls from her occasionally, not always on purpose, but they've always led to great conversations. It's always good fun to talk to her. So someone who thought she could never do this now is. So that comes into my next point. So some of the most successful interventions have been combinations of exercise and education. So exercise interventions that show older adults that, you know, you can improve your strength, you can improve your stamina, your speed, your health through exercise. But they're even better when they're combined with education. So successful education interventions have focused on providing information on positives of aging. So, you know, a lot of my participants spoke about the positives of aging, you know, feeling freer, being able to focus on your family, having more free time, things like that, and dispelling myths and false beliefs. You know, if my grandmother had assumed, well, technology is just not for older adults, that belief should be challenged, and you should say, well, there isn't actually a reason for that. So the education aims to help support people to identify and reject automatic negative thoughts. So those thoughts where you think, well, that's not for me, I'm too old, I can't do that. Challenging that and just stepping in to stop that particular train of thought. And it's not to say that you need to be unrealistic. It's not that you have to think, well, I shouldn't turn down trying to swim the channel. You know, you need to be realistic and understand what's right for you, and just try, even if you can interrupt those thoughts once or twice, it can be a real positive. So my PhD research has looked at examining how perceptions of aging become negative consequences. So that pathway between, I think older adults are forgetful, to having poor outcomes in the other column. And then talking to older adults about their perceptions of aging, which has been one of my favorite parts, is those discussions with older adults on how they view aging and their experiences of it. And then testing how older adults are affected by negative perceptions of aging in the moment. So I didn't really talk about it here, but another thing that happens with being exposed to all of these stereotypes is if you're taking a test of memory for your doctor, and your doctor is telling you how awful the memory of older adults is, you may, you know, be worrying about that, let it affect your test performance, resulting in, you know, doing a poorer test. So that can happen to older adults, and I've been looking at, you know, how does that happen and why does it happen? So if anyone has any further questions related to perceptions of aging, feel free to email me, the email on screen, and I think the slides are going to be available. And I'd just like to give a big thank you on behalf of myself and Annalisa and the School of Applied Psychology to all the Step Up Your Health participants. If anyone has any further information, to contact Dr. Setti, and if they want more information on our lab activities, to go to our website, acmelab.science. So thank you very much for your time.
Thank you, Feargus. I think if anybody has any questions on any of our points, we're welcome them.
Okay, that's great. That was very interesting, Feargus and Annalisa. Thanks very much. There was a question about the definition of middle age and midlife. I was thinking, is it 45 to 65 or 40 to 60 or what's?
Yeah, so there are different, actually different studies and different guidelines take different approaches. So we generally go up to age 65 with middle age, and then 65 over we consider older age, simply because we take the average retirement age as a landmark.
Right.
So that would be, but there are different definitions, you know, depending on if you take a more biological approach or, you know, whatever approach. But usually we would take 65 plus. But in Tilda, for example, the Irish longitudinal study on aging, the sample starts at 50, and then people are tracked from 50 on. So again, I think the emphasis now is less and less on categorizing people as middle-aged, older, and using a more flexible approach that is more tailored to individual differences, to the level of, I suppose, disabilities that the person has and abilities, and what you can do, what are your individual characteristics. So we're kind of moving away from this idea of being older and being middle and being younger, but more in terms of, you know, what because within the same age there are huge differences, and it is these differences that we need to understand. For example, in the first talk, there was, you know, talking about cognitive reserve and how we can build our cognitive reserve to prevent dementia. And this is important because this cognitive reserve can really determine a 60-year-old or an 80-year-old. They could be, you know, the 60-year-old could be like a 70-year-old that has more cognitive reserve. So we're moving away of this idea of, you know, in some ways boxing people into categories to be much more individualized in our approach.
Yeah, it makes sense. Yeah. So there's a question here: if we're surrounded by negative perceptions, how do we manage to block that information to allow our minds to be open to more positive perceptions? That's a good question.
Yeah, I'll jump in there. So I think the you know, it's very difficult when we are surrounded by negative stereotypes about aging. It's in our media, it's in our discussions. And you can see that in my discussions with older adults. And it kind of ties in with the first question. Nobody really considered themselves old. That was something explicit I asked. I said, you know, do you consider yourself old? And everyone was like, no, I'm not old, because there were older people. You know, 80-year-olds were telling me they're not old, their 90-year-old friend is old. So these kind of perceptions of aging are everywhere. The way to challenge them as best we can is explicitly, if we're able to. So if someone says, well, no, you're old, you couldn't possibly do that, is to outright challenge them on it and say, well, you know, is there a logical reason, you know, which I think is the best approach, but also just trying to see it where we're doing it ourselves. So if you're thinking, well, no, that's not for me, I'm too old, is there an actual reason you couldn't do it? Is there an actual reason there's a limitation? You know, if you're not physically able, that's okay. But if it's something like, no, there's no way I could learn to use a smartphone. Like my, again, 90-year-old grandmother who wouldn't really use a television managed to learn to video call her grandchildren in the last year. So I think anyone can. So I think stepping in and interrupting those sort of negative thoughts and identifying them as the first stage of that is the most important step to blocking those negative perceptions. So explicitly in addressing it when people bring it up, and then in ourselves whenever we can as well. But it's really difficult, and you do have to sort of take your time and one step at a time.
Great. Thanks, Fergus.
Can I just jump in to say, well, Fergus already mentioned the importance of societal views, and I think that's really important that when we talk about, you know, preventing dementia and, you know, what we can do, that's really important. But advocacy is also very important, you know, because the person always operates in an environment. So I can tell you, nature is important, go out in nature. But if you don't have available nature now within your 5Ks, you can't do that. I can say, okay, exercise, but if you don't have available maybe supports for that, that's not as easy. So I suppose that's why advocacy is very important, and these community groups are very important because they bring things to life. They bring science to life really at the forefront of where things happen and where the real problems are. Because it is easy on my part to say, yes, you have to briskly walk half an hour a day for 5 days a week, and that's the guidelines. But what if I have arthritis? What if I feel tired and exhausted? And that's why I think community, randomized controlled trials are fundamental to understand what works, but community-based research is fundamental to understand how it works in practice, how the real people in their daily life can do these things and combat these negative perceptions of aging, and overcome all these real difficulties that we have, including our habits, because we tend to rely on our habits a lot, and break habits is difficult.
Great. So there's a question here. My father had Alzheimer's for years, starting at my age now. How do I be positive for myself around this? So do you have any thoughts on that?
I think what I can say is that there is no set destiny for anybody. My granddad had, vascular dementia, but, my parents are, relatively healthy, and I'm hopeful that I can be relatively healthy at their age. And I think that, there are genetic dispositions, but there is also, you had a different life from your father, and that's very important. Every individual is different. They operate in a different environment. They have probably a different job. Even if they have the same job, they did it with different people. So you have different types of challenges, and you can build on these differences to increase your probability of not having Alzheimer's. Now, there is no guaranteed, there is no guaranteed for me, and there is no guaranteed for anybody. But, to work on what is possible, I think is really the message, and is the message of the Lancet report that was already mentioned in these talks, that there are modifiable risk factors, and we can work on them. And that's not to say, oh, look, X had Alzheimer's and this is because he was not good enough in his life. It's not for that. It's not to judge the people that do, because there are so many factors that can contribute to, unfortunately, setting the setup of dementia. But is to say we can use what we know is good for our brain, which is exercise, which is constant and incremental challenge, which is to interact with people, try to have social lives. And these are modifiable risk factors. Then, unfortunately, none of us is guaranteed to, that will make us successful, but at least we can be in the best position possible.
Yeah, absolutely. And what Annalisa mentioned there, the first webinar that we ran, so it's on our YouTube channel. So if you look under Dementia Research Network Ireland, the talk that was on the 15th March covers that topic in more detail, and the fact that up to 40% of cases of dementia are preventable. It was Annalisa just mentioned it there, the Lancet report, very strong evidence now that the things that we do in early life, midlife, later life, it's never too late, never too early to start these things, but all those things you mentioned about diet, exercise, low alcohol consumption, etc. They can all help in terms of prevention. So it's definitely not a guaranteed outcome just if because one of your parents or even both of your parents had some form of dementia or Alzheimer's disease. So because I know there is a lot of fear. I think it's been shown that there is a lot of fear around dementia, and people often think of risk factors from their family, especially when you look at heart disease and other conditions. But there's a lot that we can do that's in our hands, as you were saying, Annalisa, to prevent dementia.
And if I can add just quickly, you mentioned early life, and that's also very important. So, you know, probably we had a different childhood than our parents, probably in some ways less challenging, you know, certainly on the opportunities that we had. So that's already puts it at a better start. And it's important to try to give this message to younger generations and work across generations. And I know I'm, you know, really trying with my children, not always successfully, because, you know, the PlayStation is more appealing than the walk in the park. But I think it's important to start early, but it's never too late.
Just mentioned there, shout out to Grania from Melbourne. She's letting us know that we have an international audience today. So
Hello.
You're very welcome, Grania from Melbourne in Australia. And it sounds like you're enjoying the session, which is great. A question here, is Dr. Setti's study available? So that's probably in terms of, you know, some report or paper or something, yeah.
So we have 2 publications underway. They're not available yet, but one will be available soon, and the other hopefully in September. So I can make them available maybe on the website as soon as they are. But if you want more information, you can always email me, and I'm happy to share whatever data we have.
Okay, great. So your email address is probably on your presentation, is it, Annalisa?
Yeah,
so, okay, so when I put it up on our website, the DRNI website, dementia-network.ie, under resources, Annalisa's details will be there. So there's a question here, how would you change the language, i.e. what word would you use to replace old age? Any thoughts on that?
Well, I don't think there's anything inherently wrong with old age. I think it's because it's so associated with negatives for a lot of people is the issue, rather than the term old age itself. You know, one of the things that I started to look forward to talking to older adults was all the positives they mentioned, which we don't really talk about. Not feeling as pressured to be someone you're not was a huge thing. A lot of the older women said that they felt much more confident and able to say things and do things that they wouldn't have said when they were much younger. So I think it's not about changing terms like old age, but also just referring to it, or trying to remember that there are a lot of positives, including things like, you know, freedom to do whatever you want. Lots of people said it was the best time in their lives. Was being sort of free from responsibilities. You know, their kids had grown up, they were no longer working. Some of them were still working, but even just having the choice to do what they wanted or not feel that pressure. And actually, I wanted to just say something on an earlier point as well, is that if people are feeling, you know, if you feel you need supports and things to grow old better, it's important to not reject them because you're sort of associated with sort of negative perceptions of aging. So like my aunt who wouldn't go for treatment, or my dad is quite deaf and has been for years, but he didn't want hearing aids because he thought they made him look old. As a result, he avoided a lot of social situations and things like that and shut himself off. And then he got hearing aids and was able to go out and talk to more people and have a lot more enjoyment. So if you are feeling like you need those kind of supports, not to use the stigma around old age to stop you from engaging with them. So I don't know if Annalisa has something else about the more positive terms.
Well, I can say what we use in research is older, because older is, you know, I'm older than my son, but it doesn't have a connotation. It's simply, you know, older and younger than. So that's what we use in research. But I see somebody suggest wise age. That's also nice. We might adopt that.
Yeah, and someone else said the third age. In Spain, they refer to old age as the third age.
Yeah. In Italy, we use that as well, just because it refers to stages of life. And I don't like when they say late stage, late life, because it has a negative connotation. But I suppose third is just a number, so that's okay.
Yeah. And certainly I sense that things are improving a little bit, you know, from say even government initiatives, and is it the University of the Third Age? You know, there's a lot more focus now on, you know, healthy aging, and
Yeah, I think there is a lot, and there is a lot of on continuous education and opportunities, even entrepreneurship in after retirement, for example. Actually, I saw a comment in the chat earlier, somebody that has already plans of what they're gonna do once they stop doing what they're doing now, and they want to be a fitness instructor. And I think that's a great example of having plans and using that as a motivation, and also keeping engaged, because that's we know that the work and education are risk factors, keeping are very big factors to keep engaged, and therefore to build cognitive reserve.
Mm-hmm. And just again on the terminology, someone's mother uses golden years. So, and then somebody mentioned about the parapositivity on successful aging. Alice Hertz-Sommer, a Holocaust survivor who lived to be 110, attributed her longevity and well-being to being an optimist. So that's interesting. And actually, just to touch on the point that was made earlier about, I suppose, research has consistently shown that as people get older, that they often feel more content and happier in life. So, I've always thought that's really nice, because we're all getting older, relatively speaking. So nice to know that in general, people often report that they're happier, more content as they age. And someone else said, what about elder?
Yeah, and if I may say about being positive, because as a cognitive scientist, I started as a skeptical towards positive psychology and the power of optimism and these kind of things, but I am a converted in the sense that there is solid research to back that up. So it is something that is important, and to cultivate that a positive outlook, and it also supports then motivation and positive perceptions of aging that as Feargus said are have clear health outcomes.
Yeah. Someone says here, renewed my driving license recently. They would only give it to age 70, even though I asked and paid for a 10-year license. This is indicative of society attitude to older people. What can be done about this type of attitude by the government? So I suppose it touches on a lot of the things we're talking about. It's the society and the environment that people are in that's important as well. We can have all the positive attitudes we want, but we need society to.
That was a big thing talking to older adults as well, that they said a lot of the news coverage and things of older adults is about being a burden on the health system. And that's kind of how they feel they're talked about in public, which, I think was really upsetting for them, which is understandable. So, again, that needs to be challenged. It's not that people are burdens on the health system. And it's awful to think of humans in that way.
Yeah,
and I suppose it's come up a lot in terms of the pandemic, hasn't it? In terms of different groupings and vulnerabilities.
Yeah, and driving can be fundamental for some people, depending on where you live and public transport availability and the layout of your environment. So it is an important issue to debate, because if there is no specific reason to not drive, it can have a very big negative impact on people. So it is something to really consider very carefully. And I mean, my dad is 89, to be 90 in May, hopefully, all going fine. And is still driving.
Yeah, great. And someone's just saying they're introducing assessment. So we could probably chat about that for another half an hour. Lots of interesting questions and comments coming in. So are you guys okay to stay on for a little bit longer, just to go through some of the questions?
Yeah, I can.
Yeah, of course.
Okay, great, thanks. So hopefully people can stay with us, because I think it's nice when we get the interaction and get the questions coming in and comments. So, and this will be recorded anyway, so people do need to log off. Obviously, you can watch the recording back, so that's good to know. So someone's asked, is there a difference in aging perceptions between socioeconomic classes? So I don't know if you've looked at that.
So I haven't looked at socioeconomic differences myself, and I haven't found any research that points it out to a huge extent, but I think it's because it's so different across different countries. you know, with a lack of retirement, a real retirement age in places like the US and things, and other countries that better support older adults. But I think from my discussions with older adults in Ireland, it definitely makes a difference in terms of their experience of aging. There were people who were very insecure in their finances that I spoke to, and that was really affecting their older age. So I haven't seen differences in perceptions of aging, but I've definitely seen it in experiences of aging because it was hugely influenced by the resources they had. That.
Yeah, and I think if you look across research in terms of cognitive reserve, in terms of, you know, cognitive aging or healthy aging more broadly, socioeconomic status is always a factor. Because of course, if you have fewer opportunities, that, you know, put you at disadvantage. Of course, you can do a lot of things, you know, there are lots of things that you can do for free and support your healthy aging and support your cognitive reserve. But there is definitely a level of opportunity that you're lacking if you are in a lower socioeconomic status. And even in very practical things, like the recent report from the APA on nature contact in the lockdown, they underline that people that have lower socioeconomic status have less access to nature. So naturally, if you have less access, you have less opportunity to experience the benefits. And that's why really working on socioeconomic differences from childhood is really important.
Mm-hmm. Yeah.
And that was another difference between rural and urban people that I spoke to. The urban people didn't complain about transport at all because they all had a relatively good public, and this is just down in Cork, there's a relatively good in-city public transport system by comparison to going out to the country, where a lot of the older adults felt that they had lost a lot of their independence in moving around. So, you know, it was those infrastructure factors that had more of an influence on them than their perceptions in that particular area.
Yeah, interesting. So slightly different tack now. Someone said they're 49 and they've noticed their short-term memory decline in recent years. And they're wondering, is there a simple test to occasionally track any decline and hopefully counter any concern? It might be their perception, they're saying.
Yeah, so there are tests that you can do. So the tests that we do in the lab now, if you do them to yourself, it's a little bit more tricky. But what we would do in the lab, for example, is we give you a list of, say, 10 words or 10 pictures. You have 1 minute to study these pictures, and then you have to recollect them. So you can do it yourself. You know, you take a list, try to remember, look at the list for, say, a minute or two, and then try to recollect it later. And this is a simple test. In fact, I think Sabina Brennan will talk about this kind of thing because she, you know, in her book, there are this type of tests, which are tests that we use in the lab. So you can do it. And I think there is a use to it in the sense that it's important to have awareness. But again, you know, tests are tests. There is a limitation to them. So we always have to take the result in the context of, you know, our life, the strategies that we use, because a test of recall of 10 words is different from using your short-term memory and your working memory in daily life, although they are related. So it's always also to keep an eye on if you feel challenged and in which situations you feel challenged.
And certainly, you know, things even like stress can actually, you know, impact short-term memory. So I suppose for people not to panic, you know, that if they go through a period of time where maybe their short-term memory isn't so good, and lots of other things. And as you said, Sabina Brennan, you know, we'll probably talk about that. Her webinar is going to be on the 10th of May as part of this series. So yeah, thanks for that. So there's a question here, should these negative perceptions about aging be addressed in early education curriculums?
So there's really interesting stuff on this. So one of the best interventions you can do for young people is positive contact with older adults. And I haven't looked at a lot of the research around it, but I've seen there was a documentary on a retirement home and a play school basically being in the same building, which facilitated positive contact between the older adults and the very young children. So positive intergenerational contact is one of the best things you can do to improve younger people's perceptions of aging. And I think it's really important. I know a lot of my positive perceptions come from having, you know, a lot of contact with my grandparents who I've been very fond of, and things like that. So I think those are really important, as well as maybe more overt talking about the positives of aging and being open about that.
If I may, talking about school context, that's actually how I met Phil Goodman from the Young at Heart, because she went with the Young at Heart to teach knitting and sewing to my kids' school, which is a boys' school, which also I thought was very important, because no gender stereotype there. You know, boys can also learn these things. So I got in contact with her because they were going to the school and teach these activities. And I think that type of thing, to see people that are older but active, and you know, the older people have a lot to offer to society. And if you want a more structured, so to say, report on that, you can look at the Tilda reports that have a lot of material on that. And I think if starting early with children in school and outside of school, like Feargus says, is fundamental.
Mm. And so the study there that Annalisa mentioned, Tilda, or the project, we should say, it's a Trinity study of longitudinal study of aging, so TILDA, and there'll be a lot of information on the website if anyone's interested in that, because it's been going for a number of years and some very interesting research that's come out of that. And actually someone asked there about any research on the benefit of interaction with young children. So I suppose what you were saying there about the older people going into the schools, was the idea that it would mutually benefit the children and the people going in doing the knitting and sewing? Was that the idea?
Yeah, absolutely, because there is a lot of talk on intergenerational benefits, so co-benefits for younger and for older to interact across generations. Because of course, you know, it's a challenge and a stimulation for kids too, to see something different, you know, to see how older people talk about things and what they have to teach. So it's a mutually beneficial activity, and that really should be encouraged in families, but also in a structured environment like school.
Yeah, and some people I know, including myself, who never had, you know, had grandparents around when I was younger, you know, there could be a situation where children haven't been used to having their grandparents around. So it's a great way to interact with older generations, isn't it?
Yeah.
Somebody asked there about which activity tracker do you advise and what activities are covered?
Okay, so in my, I haven't challenged my brain enough to really become expert in activity trackers. So, so what I can tell you is I can make available the brand that we use. There are many brands. I suppose the famous one is Fitbit, but we didn't use the Fitbit. We use another one. For various reasons, including financial. And but most trackers, like I bought one for my 9-year-old, and it has loads of functions. It has steps, and it has heart rate, you know, sleep tracking. So I think if you Google activity trackers, they're all pretty good, and they all have, you know, link with your phone if you have a smartphone, and you can have all sorts of functionalities beyond the steps.
Great, thanks. Somebody mentioned here about they advocate for their 84-year-old mother, and they find that the attitude amongst medical professionals is to attribute most decline to old age and not look at what can be done to improve things. So that kind of, I suppose, defeatist negative attitude, which is interesting, and maybe it could be something that we talk about at the later webinar as well. Yeah,
I think doctors undergo a lot of training on you know, the health aspect, which is the core of their profession. And it is only more recently that the training has started really to focus also on those other more psychological aspects, on how to deal with patients, on perceptions of aging, and I think is really coming up. So, you know, maybe you had a negative experience, which, you know, is by all means possible. But I think in training, like I work with the gerontology department and, you know, in Trinity, in UCC, and I think is something that is much more at the forefront of medical professions, to be trained in this psychological aspects and sort of patient interaction aspect. So it will come that these negative experiences eventually, you know, disappear, hopefully.
Yeah, kind of an ongoing process, I suppose.
Yeah.
There's a comment here about transition year students from this person's school where she teaches. They linked up with the local active retired association to show them how to use different apps on smartphones, etc. And yes, the students can learn so much from the retirees. So that's a nice example again.
That's
of
great.
that, intergenerational interaction, which worked well. So we might, I might just take one or two more questions or comments. So there's quite a lot here, but let's see now. Okay, so we looked at that. Okay. I prefer to be called a senior. It indicates where I am in terms of age, but without the attendant negative associations with title old. Yeah, senior. Yeah. I like that. Okay, so we've covered that. Presently, being rural gives 5 kilometre limit, much fewer options. Yeah, that's the sign of the times we're living in. Okay, that TV program is called Old People's Home for 4-year-olds. Okay, done by ABC TV, Australian Broadcasting TV.
May I say on the 5K, I think it is important to. It is definitely true that there are people that are at disadvantage now. So it is kind of to think what I can do now. You know, if the person has a garden, you know, what can they do? Maybe there is a course that they can take online. You know, I don't know if they live alone or if they live with somebody, you know, they can pick up a new hobby. They can do, you know, there are exercise programs that you can find online, even sitting down on a chair. So I think it is kind of, it is difficult because, of course, as I said, we're all very keen to use our past experience and stick to our habits, but it is, there are things out there. So, you know, it is worth trying to find them.
Look at different things. Okay. So we might wrap up there because I'm conscious of the time, and just to say thanks very much to Dr. Annalisa Setti and to Feargus Fawsitt from UCC, and thanks to Sinead, who was in the background on the technical side of things. And thanks very much to everybody who, most of you have stayed on, so that's great. Thanks very much, and for all your interesting comments and questions. It's actually a very interesting topic, and I think we could nearly run another webinar, I think, on this particular topic. There will be a final webinar in the series, and there's still tickets available for that. And it's called Ask the Experts. And so all the presenters from this webinar series will be attending that one. And so any questions that we haven't had a chance to cover, hopefully we'll be able to cover them that day. So that's the 24th of May at 11 o'clock. So we might just, Feargus, if you just want to stop sharing your screen, if you don't mind. And then I'll just show you the next details of the next webinar, which we're going to take a break for Easter. And we're going to, it's just coming up now. So on the 12th of April at 11 o'clock, it's going to be cognitive rehabilitation and cognitive stimulation therapy for dementia. So hopefully some of you will be able to join us for that. So have a good day and thanks again.
Thanks very much.
Thank you. Thank you.